So the Health Hubs, the Rural Health Hubs is a project that has come out of the Health Links project, the bigger Health Links project. So we're really trying to target people who are in the rural areas, people who don't have transportation, people who might have trouble getting transportation in and out of town, and people who, of course, don't have a family doctor. In the area when we first started, we had no labs, we had no pharmacy, we had no primary health care, and now we have primary health care services. So we do chronic disease management, well baby checkups, well woman, well male, lab for the area for my patients. So if I'm doing a diabetes checkup, I can do the blood work for that. We've also had services like dental hygiene here. So it's whatever the community wants, and each community will be a little bit different. So that's the idea of the hubs, is that we can bring in professionals that the community needs.
My name is Jerry Fox, and I am a Mohawk. Both of my parents are from here. I think most people within our community and the surrounding area are absolutely delighted with not only the facility, but the staff as well. So.
My name's Bob Bowden. I live up on Gibson Lake. I had a family doctor in Barrie, and he retired. And with the problem there, you're waiting 6, 7, 8 weeks to get an appointment. And here it's been, the access has been incredible. I think it's one of the best things the ministry's ever done.
My name's Gordon Holmes. I live in Port Carling. I've come here to have a primary health care professional, nurse practitioner, essentially to replace my family doctor. I was with her for 28 years, but the last 13 I've lived up north, and I've had to commute down to Burlington. It's been quite difficult for me. I'm older, so I need a few more diagnostic tests. I'm also getting ready for hip replacement surgery. And again, I'm doing it through the offices here, and I'm doing it in Parasound. I'm also working overseas. I'm an international university professor in Mongolia. So they're helping me prepare here to go over there and work.
My name is Phyllis Adamson, and I live in Bala. A couple of years ago, Dana discovered that I had an aneurysm. As it turned out, I had 2 aneurysms. And she directed me to a very nice doctor in Barrie, and my aneurysms were repaired. So, as far as I'm concerned, she saved my life. And then she saved my life a second time when she discovered I was short 4 liters of blood. Not only did she save my life twice, but she probably saved it a 3rd time, because I quit smoking June 2nd, the night before my aneurysms were repaired, and have not had a cigarette since.
We are rural health hubs for rural people, so that they can have the right health care at the right time in the right place. But also we have the backing, the support of the dietitian, the counseling, and then the physicians that are there too, and then the ties to the hospitals in the area.
For one thing, we are so remote. To get to, we did have a doctor in Bala, but he has now retired, so really we don't have anything that's close to us at all.
You know, if you had to drive an hour to your doctor and an hour back, you know, are you going to go in for your preventative screening? Whereas here it's just, you know, we have people, just keep calling people up and saying, hey, your mammograms due, your paps due, come on in, and you know, we're like 10 minutes away. So I have almost 500 patients. We have about 1,000 that we've seen so far, but we also have another clientele where we see summer patients or patients that might have a family doctor, because we have no walk-in clinics here.
Anderson, and I'm the community chair for the Port Severn location at the Muskoka Health Hub.
My name is Debbie McMaster. I live in Port Severn, and I'm a patient.
You were saying that you just moved into the area recently?
Yeah, about 5 years ago from the city, and trying to find a family doctor was impossible. And I had to go to the hospital a few times just for general.
So even if you have something as simple as a throat infection or a virus of some kind, you have to go to emerge, and that's not good for the hospital, and it's not good for the residents either.
You know, traveling, especially in the wintertime, I mean, that is scary in itself. So if it's in this area, people will be able to get here. And I think that's important.
So 1 day a week is an incredible start for the community. We've had great response and people coming. We had one couple in particular who donated the funds to actually outfit the entire room, including all the medical equipment that we have that's needed to run. So we were very lucky. There will be teleconference services that are available out here as well, which means that they can come and they can sit with the nurse practitioner and they can do a consult from the confines of this office down to Toronto, up to Sudbury, to a specialist. Mobility being an issue, and with distance being an issue, it could provide a lot of life-saving opportunities for the community.
Practitioner, and I started here a month ago. We offer primary care for people who don't already have a primary care provider in the area. Plus we provide episodic care for seasonal visitors, so we're expecting to see a big increase over the summer months. And episodic care to people who may have a local provider but can't access them at the moment that they need them. We've had people with primary care providers 3 hours away, so this really is helping them. 90% of the people that we have taken on either don't have a healthcare provider or they are homebound and can't access their healthcare provider. But there have been people from a couple of people who said now that the hub's opening, they're going to be staying in the community longer.
In the township of Muskoka Lakes, there's one doctor. There's 6,700 permanent residents, but in the summertime with the seasonal people up, it goes between 34 and 36,000 plus visitors. We did a quick survey in the fall of 2011. We found out there was 351 people that did not have a doctor.
And Port Carling is really the hub of the three major lakes, Lake Muskoka, Lake Rossa, and Lake June. So it's very centrally located for all the seasonal people, as well as the permanent residents that live here.
And the community see this as their community health hub?
The community has then been raising funds. To date, we have raised $1,800,000 towards the $2 million goal that we set.
My name is Jennifer Grando. I'm a nurse practitioner with the Cottage Country Family Health Team, and I will be practicing on the Mobile Health Hub unit. So we can provide all the services on the Mobile Health Hub that you can access in your own primary care clinic. So all of the screenings, all of your annual health exams, any chronic disease management, we'll be having suturing, you can get blood work done here, and we'll be transferring it to the lab. This is the diagnostic wall unit with the blood pressure, temperature, otoscope, and ophthalmoscope set. This is a hydraulic bed. We'll go up and down to meet patient needs and to save space. We'll have the ECG machine over in the corner. In this corner is a desiccator for lesion removal. We want to be able to fill the need of the community. We believe that there will be more need than we can service, just given the communities that are remote around Muskoka. We don't want people to feel rushed. We want them to feel like they are respected and that their time is valuable, and that my focus is entirely them when they have their appointment.
I find that people, it takes a while to establish trust, but now people trust us, so they'll come in when they have something going on, right? So.
Well, I think having the health hub here makes people feel ownership, which is really important. And we have a lot of new babies in the neighborhood, so hopefully they'll make use of the facility. And when you have a positive person in the facility, it does make a difference too.
You're sitting here and you're engaged in conversation, and a lot of us are from the same community, so it makes it nice. So it is really probably serving a need even beyond the medical, physical thing of a lot of social interaction, and I like that.
Having Dana here and her efficient staff have been a godsend to me and my husband and my family. I can't say enough about them. They feel for you and they help you like you were family.